Good morning and welcome. I am Danielle Green, Executive Director of State and Local Public Health Initiatives at the CUNY Graduate School of Public Health and Health Policy and CUNY COO of the New York City Pandemic Response Institute, and as Ansley said, your MC for today's webinar. On behalf of CUNY School of Public Health, the Center for Immigrant, Refugee and Global Health, and the New York City Pandemic Response Institute, welcome and thank you so much for joining us today for Building Capacities, Building Power, Developing the Workforce of Migrant-Serving Organizations in New York City and New York State. The webinar will focus on efforts to advance workforce development initiatives for migrant-serving organizations in the city and state. The objectives of today's conversation are to highlight the workforce challenges faced by migrant-serving organizations, describe opportunities available to migrant-serving organizations or MSOs in response to these challenges, and encourage networking and community building among MSOs and allies supporters to continue to build collective capacities. Our panelists today represent leading public health and migrant-serving organizations in the city and state. They are Ansley Hobbs, a researcher with the Community Convening and Learning Team at the New York City Pandemic Response Institute, to discuss their recent report on community-level data from community-serving organizations in New York City. We have Kiwi Brady, Director of Member Services and Leadership Development at the New York Immigrant Coalition, who will offer her insights on NYIC programming designed to strengthen the capacity of community-based organizations and respond to the specific needs of vulnerable populations. We have Erin Knoerl, Director of the New York State Public Health Corps, who will detail a pilot program in which the Corps is matching interested migrant-serving organizations with qualified public health Corps volunteers to increase the immediate health-focused service capacity of these organizations. We have Keshana Owens-Cody, Workforce Director at New York State Department of Health, who will review workforce development efforts available throughout the state. And finally, Salvador Altamirano Segura will provide us with a perspective from a migrant-serving organization in upstate New York. Their presentations, each which will be 10 minutes, will be followed by a panel discussion and QA on the workforce development needs and priorities of migrant-serving organizations, facilitated by Kathleen Curvero, Distinguished Lecturer in Health Policy and Management at CUNY SPH and the Director of the Center for Immigrant, Refugee and Global Health. And we're going to get started. Our first panelist is Ansley Hobbs, as I mentioned, a researcher for the New York City Pandemic Response Institute, which is a newer resource supporting New York City agencies, organizations, and communities to prepare and respond to critical public health crises, whether viruses or environmental or human caused. She is also the project officer for the Migrant Health Research Hub at CUNY Center for Immigrant, Refugee and Global Health. In this role, she oversees the development and implementation of priority tools and resources designed for migrant-serving organizations in the city and state. Ansley? Unmute, Ansley.
Thank you. There has to be one per meeting, right? Everyone can see my slides okay? Fantastic. All right, I'll go ahead and get started. So thanks everyone for joining us. My name, as Danielle said, is Ansley Hobbs, and I'm a researcher with the New York City Pandemic Response Institute's Community Convening and Learning Team. So I really mostly want to set the stage for this conversation today by briefly presenting some of the findings of the Community Convening and Learning Team's report on the impact of COVID-19 on New York City communities as identified by community level data. Specifically, I'll get to a lot of the challenges that we found community-based organizations are facing in the wake of COVID-19 and the ways in which that they've requested assistance from academic research institutes, government institutions, what have you. So If I can get my slides to advance, there we go. So I'll start by saying that the community convening and the learning team at the PRI feels that it's really important to reflect on the value of community level data that's collected by community-based organizations and nonprofit organizations. So we use sources of community data that are sometimes overlooked or excluded by either organizations, academic or government analyses, because they're not available sometimes in the peer-reviewed literature. So what we did was we started by doing a scan of 50 different data sources. These are organizational websites that host their own research initiatives. And we found 68 different community level reports on the impact of COVID-19. So the slide gives you a little bit on the population of focus of these reports and the different topics of study. You'll see, job insecurity, kind of workforce needs are right at the top there as one of the primary topics of study that we uncovered. But really, overall, we found that New York City really experienced a disproportionate COVID-19 burden, an extremely high number of cases, hospitalizations, and deaths in our communities. And we also found that historically marginalized communities were particularly impacted by this crisis. Importantly, marginalized communities have been served by community-based organizations historically, who are very effective conduits in health promotion, including health communication, distribution of preventative knowledge and services. However, these providers often struggle to keep services going in the midst of severe staffing and funding shortages due to COVID-19. So looking at this critical role of community-based organizations, these orgs are really the backbone of community services and resources within New York City, and they stepped up in a very big way to fill major gaps in community needs during the COVID-19 crisis. However, we also saw that a very large number of community-based organizations and nonprofits shuttered during COVID-19 as the pandemic response, which was required to support New Yorkers, actually exacerbated a lot of the pre-existing issues that were already present within organizations, including underfunding, staff shortages, programming challenges, and a lot of weak digital infrastructure that was required to support a remote transition. There were a lot of issues around the transition to tech. And so additionally, because CBOs are typically run by community members themselves who I often identify with maybe the migrants that they're serving, many of the leaders and workers within these organizations frequently felt a double burden from COVID-19. They faced resource limitations, both personally as well as professionally within their organizations. So this doesn't paint a very pretty picture for the state of CBOs following COVID-19. We have seen a lot of recovery since the initial waves that swept through New York. However, critical limitations for organizations were really revealed during this crisis. And so we hope to, offer this presentation and many other resources to organizations to help fill the gaps of, of the different findings that we've uncovered. So I'm now going to turn from this study that I worked with at the PRI to just highlight one finding from a different study that I worked with at the Center for Immigrant, Refugee, and Global Health. This was a study that we completed at the beginning of COVID-19. And during the study, we sought to understand how organizations were being impacted by COVID and how they wanted to be supported by an academic research institute such as ours. So this bar graph really gives us a peek into the types of problems that organizations were facing. We can see that, we've separated it out into the complete sample, which again, it was a limited study, just kind of a quick sample of 38 organizations to see what they were struggling with in New York. But we separated them out by health CBOs and non-health CBOs. So we could really identify the ways in which maybe health organizations in the midst of this health crisis were really struggling. And so we wanted to figure out what ways that we could strengthen capacity. So you'll see on the bar graph that there really is, the most pronounced finding was that the limited staff capacity was felt really very strongly by health CBOs. This is because many of these organizations really quickly took on a role of a COVID-19 community access center. They provided testing, vaccination, counseling within their communities. Many times this was either, on their own initiative by helping spread communications in Native population languages, or by partnering with the city and the state to actually provide these services to their communities. And so what we really aim to do is further strengthen the knowledge, skills, and staffing of these organizations to support service delivery, and maybe even train organizations who previously hadn't been working in the health space to increase their capacity to meet the community health needs. So looking forward with the PRI, there's several different initiatives that we're working on with the Pandemic Response Institute to begin to really fill in these gaps. So we're continually assessing workforce needs. We have a workforce capacity and preparedness team who is currently conducting key informant interviews and different needs assessments with organizations so that they can figure out what opportunities organizations are looking for and continue strengthening the capacity of these groups. So hopefully in the future, you'll continue to see either events like this or continuing education credit opportunities available to organizations. Please keep an eye out at the Pandemic Response Institute website, as well as with the New York State Impact Center, that's the Immigrant Provider Action Center. Both of these initiatives will be providing continuing education opportunities, trainings, and all of this is geared towards organizations to strengthen their capacity. I also want to note that the CUNY Law School's Emerging Needs Law Clinic has opened to allow, where they're assisting asylum seekers with their applications, with other administrative forms. And it gives the potential for CUNY SPH faculty and students to provide public health education, some mental health care, trauma-informed care, and conduct needs assessments for continually assessing the needs of asylum seekers. So I just want to highlight these two opportunities. And at that, these are my references from those slides. And I want to post my contact information. If anyone has any questions about this presentation or would like me to share the publications, some of them are preprint from those, then I'd be happy to do so. Also, if you just want to connect and reach out, I'd be happy to hear from you. So with that, I'll turn it over and let all of my esteemed colleagues tell you about all of the fabulous programs that they're working on so that we can, continue to go onwards and upwards with our capacities for our organizations. So thanks so much.
Thank you so much, Ansley. That was a wonderful presentation and wonderful data. Next, we have Kiwi Brady. She is the New York Immigration Coalition Director of Membership and Capacity Building. In her role, she runs leadership development and service programs such as the NYIC VISTA program, which places AmeriCorps members in service at nonprofit organizations around the state, where they build capacity for immigrant-focused anti-poverty programs and services. She also runs the NYIC Volunteer Program, which provides opportunities for individuals to support diverse immigration services, advocacy efforts, and fundraising campaigns. She has a leadership role in the ongoing development of NYIC's membership program, which works to support and engage nonprofit organizations in immigration advocacy and service campaigns, and created the New Americans Youth Leadership Corps, a leadership development and service program for first and second generation immigrant youth. We're thrilled to have her with us today. Kiwi?
Thank you for the introduction. Yeah, so my name is Kiwi Brady. I'm the Director of Membership and Capacity Building at the NYC, and we are, if you're unfamiliar with us, the New York Immigration Coalition. We are a statewide organization. We are primarily known for our advocacy and policy work, although we do a lot of work beyond that. And we are member-based, and we're a member-based organization. And for us, members are nonprofit organizations. We work with nonprofit organizations throughout New York State and beyond. We currently have 155 nonprofit organizations officially a part of our membership network. About 2/3 of them are in New York City, and the other third is spread out amongst the other regions of the state. So before I begin talking about some of the ways that we try to support our members with capacity building, and I should also apologize, I actually may be coughing at various points while speaking. This is because I'm actually recovering from COVID. I recently got it for the first time, and so I'm negative now, but I do have a lingering cough. So just be patient with me if I struggle to speak at moments. But yeah, before I begin talking about some of the strategies we use to support our members, I just want to quickly talk about what I see capacity building as. And so I personally define it as a set of activities that an organization can undertake to expand its scale/reach, efficiency, and/or effectiveness of its programs and operations. And I guess in more simple terms or practical terms, I see building capacity for an organization as meaning obtaining, increasing, or improving an organization's human resources. So its staff and volunteers, the people that do the work, its financial resources, the money that it uses to pay its staff and its other expenses, its budget size, the skills and knowledge held by its personnel, their expertise in different programmatic and operational areas, its resources and tools, like a CRM system like Salesforce, um, and also the systems and practices that it uses to do its work, hopefully in the most efficient and effective manner. And I feel like anytime an organization undertakes capacity building efforts or an organization tries to support other organizations with capacity building, in order to be most successful, you kind of have to try your best to address all those different pieces. They're all independent, but they also intersect in a huge and complicated way. And so it's very important to try to address that holistically if possible. So in terms of the NYC's membership, as I mentioned before, we currently have 155 organizations in our membership spread out throughout the state, and they really vary in terms of their capacity levels. Some of them are really large organizations with budgets that are in excess of $10 million and over 40 staff members. Others, on the other end of the spectrum, have budgets that are under $250K and might only have a handful of staff members or might even be primarily volunteer run. So it can really vary in terms of the resources that they have access to, their skills of generating new funds, and among other things. For the NYC, it's very important that we support our member organizations and our partners with continuing to develop their capacity because one, we simply want them to be as sustainable as possible. We recognize they are on the front lines of this critical work, and we want to make sure that they have the resources to continue to grow and continue to serve the communities in the ways that they are currently serving them. And so we just want to support them in just growing their capacity in general so that they can take their expertise and deliver their programs and resources at the highest scale possible. And then beyond that, the NYC is very much a coalition. We do not do our work in a vacuum. We do our work in partnership and collaboration with all of our member and partner organizations. It's very important to us that we also support our members in building capacity so that they can engage in our collaborative advocacy and implementation campaigns at the highest scale possible, as we are all stronger when we work together. And so those are, I would say, our primary interests in supporting our members and our partners and continue to develop their capacity. So in alignment with some of the data points that were shared just a few minutes ago, we also do surveys, formal and informal surveys of our membership to continue to understand their needs and figure out how we can best support them. And in our last formal member needs assessment survey, over 70% of our member organizations indicated that fundraising was their primary organizational need. And so that's something that we have tried really hard to invest in. So I only have a few more minutes before I need to pass the mic. So I can't go into detail about every single thing that we do to support our members with capacity building, but I'm just going to highlight a few big things that we try to do every year. So one way that we try to support our members in building capacity is around financial resources. So we try to, throughout the year, bring in new funds into our organization. And for a lot of the grants that we are able to secure, what we'll actually do is then take a large portion of that grant money and re-grant it to our member organizations. So basically taking our expertise with fundraising and our connections with different funders and bringing in funds that we then redistribute to our member organizations. And so we'll run various RFPs during the year with the funds that we can use for re-grants, and from those RFPs award re-grants to our member organizations. For your average year, we typically re-grant somewhere between 1 million and 2 million to our member organizations. This past year, though, has been a little bit different. We very recently were able to secure a very large government grant and have from that awarded over $10 million in re-grant awards to our member organizations. So for the past 12 months, we've actually awarded over $11 million in re-grants to 74 unique organizations in our membership and partner network. And I would say for some of the re-grants that we provide to our members, us playing an intermediary role can be extremely important, not only because of our ability to bring in the funds, but also in the case of things like government grants, which can be extremely challenging for organizations to apply to and manage. It can be really helpful to have an intermediary like us there to directly support the subcontractors and subgrantees with being able to adhere to all the expectations and regulations that are required by government funders. And so for a lot of the organizations that we recently awarded those government re-grants to, they are brand new to government funding and brand new to all the policies and requirements that are in place. And so we were able to directly support them in adjusting to all those, which I think is a big value add. I won't go into this in too much detail here, but since we were just talking about the pandemic, I'll also note that when the pandemic initially started, we went into rapid response mode with our member organizations. We very quickly developed a cash assistance program that we brought our member organizations into, and we partner with our member organizations to distribute almost $3 million in cash assistance to community members impacted by the pandemic. And in that program, my team basically became a bank, and we developed a screening system. We had our member organizations screen community members, and then they would submit the forms to us, and then we would just review them, do a final review of them, sign off of them, and then we gave our member organizations plastic debit cards, and then we would remotely move money onto those debit cards for the approved clients for them to then give to the clients and for the clients to use for their needs. In addition to re-grants, we also run an AmeriCorps Vista project. So we've been basically authorized by the government, federal government, to run and manage an AmeriCorps Vista program. AmeriCorps basically is a program that places individuals into volunteer-like positions for a period of time. For our program, for the Vista program, the AmeriCorps members are in service for a full year. They get paid a stipend, and they specifically work on capacity building projects for their host organization. And so from our program, we're able to directly inject human resources into our member organizations to support them on working on things like fundraising, volunteer management, developing programs, among other things. Our VISTA program typically supports our member organizations to be able to raise, with the VISTA support, over $2 million or more dollars per year, and manage several hundred volunteers every year. So that's another way that we support our member organizations. In addition to that, we also, so that's us supporting them with human resources. We also try to support our member organizations with to continue to develop their skill and knowledge to do this important work. We offer trainings throughout the year on continuing legal education, on best practices around providing various direct services. We offer a very popular 40-hour training that supports individuals and organizations who are seeking partial DOJ accreditation, which allows non-attorneys to provide immigration legal services. And so that's another way that we try to actively support our members every year with those trainings. And then I guess the last thing I'll just quickly mention, and I don't want to take up too much time at this moment, but is a lot of our advocacy work is also directed at local and state budgets, which will then ultimately provide funding to organizations who are doing critical direct service work. And in partnership with our member and partner organizations, this past year, we were able to get New York State to invest over $60 million in immigration, legal, and other essential services. So that's another way that we support capacity building with our actual advocacy work directed at government budgets. But yeah, so I will stop there and pass it back to our moderator. And I'm sure if you have any questions, I'm happy to answer them later.
Thank you so much, Kiwi. As Ansley put in the chat, the funding for local providers and service organizations was such a huge need during the pandemic, and I was so excited to hear about that. And I'm sure there'll be questions later on about how you managed to do that. Our next presenter is my former colleague, Erin Knoerl. She's the director of the New York State Public Health Corps Fellowship Program at the New York State Department of Health. The Public Health Corps was created in 2021 to support COVID-19 vaccination operations and increased preparedness for future public health emergencies. Erin leads these efforts by supporting fellows at the local and state level to achieve public health goals. Before she took on this role, Erin was the assistant director for the Corps, and before that, the oral health unit manager in the department's Bureau of Child Health. Her work includes development, management, and oversight of programs and projects and administrative operations, contract management, partnership development, and stakeholder engagement, as well as performance management, quality improvement, and grant writing. Pretty much everything you need to do to run a program. Ms. Knoerl has been with the New York State Department of Health since 2010. Erin? Please unmute.
Sorry about that. Okay, let me try that again. Okay, hopefully everyone can see my slides. Okay, so in January 2021, as part of the State of the State, the New York State Department of Health was charged with developing a public health workforce program to bolster the public health infrastructure and capacity at the local and state level, with the directive and support from the governor's office. The program was conceptualized, developed, and implemented pretty rapidly over the last 2 years. Our main mission was to build expertise in workforce, including community outbreak response and infection prevention and control at both local health departments and the state health department, via employing fellows who could address the unique cultural needs of those at highest risk to COVID-19, and to increase capacity for timely data management, analysis, and reporting for COVID-19 and other emerging infections, along with conditions of public health significance. You know, in doing all of that, we really hope to realize this vision of building a robust, diverse, equipped, and dedicated public health workforce that represents the various communities comprising New York State, and to shape a workforce that's aware of the intricacies of systems thinking and the necessity of community collaboration and uses of the strength of community to achieve health equity. So we're currently funded through 2 cooperative agreements from the Centers for Disease Control and Prevention. In July of 2021, we sent letters of intent to all 57 local health departments, excluding New York City, with the funding and the fellow totals, along with the scope of work, which is really COVID-19 response, so that's your vaccination and testing efforts, and recovery. So those would be programs that were sidelined or impacted during the pandemic. So in order to fulfill that vision I spoke about just moments ago, fellows have been recruited by the local health departments, along with the state health department, to meet their individual needs. As of today, we have 50 counties in New York State and the Department of Health participating in the fellowship program, and all have agreed to serve as placement sites for these fellows. In addition to local and state health departments, fellows may also be placed at host organizations, including community-based organizations selected by local health departments. So far, we have about 340 fellows currently employed and almost 500 who have been hired to date. So our fellowship's a mix of real-world public health work and professional development. Key programmatic activities that we have as part of our program, the first is Public Health Essentials. So we provide all fellows with the opportunity to participate in Cornell University's online Public Health Essentials Certificate program. This course introduces, reviews, and reinforces key aspects of public health. We also have regional consortia, which are meetings where fellows and our program partners come together to meet virtually on a quarterly basis to provide opportunities for additional education, network, real-time discussion on current public health topics, and other opportunities to support fellows, progress with their work. They're also allowed to kind of share where they're currently at with the projects and, again, network with each other. We also hold an in-person annual summit each year, bringing together all of our program participants from across the state. Our next summit is this December. We have a monthly educational series where our fellows and stakeholders come together to attend trainings that really focus around our 10 core competencies. We've covered budget and financial management, change management, and database decision making. And last but not least, we have mentorships. So public health professionals from the community, from local health departments, from the state health department, serve as mentors for our fellows. They really guide fellows in their professional development and expanding their public health network. So in order to guide the development of our programmatic activities and components, we identified 10 core competencies, which have been adapted by de Beaumont Strategic Skills. By facilitating fellows' development in these core competencies, we believe that we're building a workforce that's greater than the sum of its parts. So as I mentioned earlier, fellows' public health work really centers around different focus areas on COVID-19 response and recovery. The host site, those local health departments, the state health department, prioritize what's most of need in their specific region or community. And here are just the 8 key focus areas. So I wanted to feature some of the amazing work of our fellows that they've been able to accomplish since joining the Public Health Corps. One of these initiatives is Capital Regional Menstrual Health, which is coordinated by Cornell Cooperative Extension through the Albany and Schenectady Fellowship Programs. In November of 2022, 3 fellows launched their first period pantry. This concept's similar to little free libraries, and these pantries are stocked with a variety of free menstrual hygiene products. Individuals from the community are welcome to take really what they need. They've launched an additional 5 pantries in Albany and Schenectady County. And they also, in addition to doing that work, the fellows facilitate educational programming on period equity as part of their work. And in December of 2022, Capital Regional Menstrual Health was awarded a grant from a local nonprofit to continue their important work. The next project I wanted to feature is RAHAMA, which stands for Resources and Help Against Marital Abuse, which is the only female and Muslim-led nonprofit organization in Western New York that specializes in underserved immigrant, refugee, and Muslim women facing domestic violence. Their goal is to empower survivors and guide them to independence by providing throughout the entire journey. So 2 fellows were placed by Erie County Department of Health at RAHAMA, and these fellows are working to assist the population by finding ways to lower barriers to services. They developed programs and presentations that allow and encourage women to be able to live a life away from abuse. One of their most recent initiatives is the fellows have partnered with Stitch Buffalo to set up a Learning to Sew event, where RAHAMA clients will be able to learn how to sew and how they can sell their own individual crafts. And then finally, I wanted to feature Herkimer County Public Health, where they have a Public Health Corps fellow working with the local health department to establish the Herkimer County Children's Center. Herkimer County is a rural county in the Mohawk Valley region of New York, and the demand for childcare is one of their most pressing issues. The fellow has been able to work with the county public health department since 2022 and has played a key role in the development of the proposal for the Children's Center. This center will utilize cross-sectoral approach and provide a variety of vital services, including childcare, early intervention programs, childbirth and lactation counseling. Herkimer County is hopeful that the construction will start later this year or early next year. So pretty much all in all, the fellowship program has proven to be beneficial to both fellows and host placement sites. Not only does this framework attract talented and passionate fellows to the public health workforce, it also facilitates retention of these fellows at their host placement site. You know, of our inactive fellows, about 26% of them accepted a full-time position at their local health department or the state health department. Just some key recommendations for implementation is to really identify key stakeholders early on in the conceptualization and development of the program, as well as continuing to engage them to incorporate their feedback. We feel that it's vitally important to have buy-in from the host placement sites, as they have a large influence on the fellowship experience for both fellows and their supervisors. Also, community members have provided valuable feedback and guidance and implementation of the program. Another key recommendation is that we anticipate potential changes to the scope of work for fellows due to the emerging and changing public health issues. We were born out of the COVID-19 pandemic, and the work and our fellowship plans really kind of reflect that, but that we have to be able to adapt to the increasing priorities. So really our next steps is just to continue data analysis and a program evaluation and to identify additional funding for this program. Currently, our fellows will end in June and July of next year, but we hope to launch another cohort next summer. So here's our website if you're interested in checking us out. And thank you so much for having me here today.
Thank you so much, Erin. That was wonderful. And I can't believe that the first group is almost ending their 2 years. Remember when you were recruiting. Our next speaker is also from the New York State Department of Health. Keshana Owens-Cody is the Workforce Director for the Office of Public Health. She manages the Centers for Disease Control and Prevention Public Health Infrastructure Grant, which invests in recruitment, retention, training, development, and improvement of the organizational systems and processes for the public health workforce, including local health departments, as well as the modernization of data infrastructure. Prior to this role, Keshana was the Director, Bureau of Health Equity and Community Engagement in the Division of Family Health, and managed the CDC COVID-19 Health Disparities Grant. This grant created funding opportunities that deployed COVID-19 health literacy through community-based organizations trusted by their communities. Through her leadership, the Bureau created an equitable request process for proposal and awards to bring funding to organizations that could reach populations facing insurmountable disparities throughout the COVID-19 pandemic. Keshana has been with the department since 2022, and prior to that had 10 years as a subcontractor with subcontractor experience through previous employers who received funding from the New York State Department of Health. Keshana?
Good morning, everyone. Thank you for having us present. I wanted to talk a little bit more about the CDC Public Health Infrastructure Grant. I'm leading this effort with a team that will be really focused on, as mentioned in the bio, that we'll be focusing on strengthening our public health workforce as it relates to recruitment and retention, data modernization, as well as foundational capabilities. As it relates to this discussion today, I wanted to talk a little bit more about strengthening our foundational capabilities. Foundational capabilities include training and development. It includes community partnerships and development. And that's an area that we want to focus on during this conversation, as well as strengthen with the public health department. As Erin mentioned too, we are collaborating a lot as we're rolling out this grant. We received this grant in December, so we're just starting to roll out the public health infrastructure grant. And one of the things that we want to do is build on our lessons learned from the COVID-19 pandemic. So by collaborating with learning lessons from the Public Health Fellowship, as well as the Bureau of Health Equity that did release community-based grants to the community. I want to talk a little bit about that. The Bureau of Health Equity and Community Engagement that is in our Division of Family Health did have a COVID-19 Health Disparities Grant that was really focused on bringing COVID mitigation strategies to communities that were disparately impacted by the COVID-19. They were charged with reaching prioritized populations through another CDC grant. And with that, what they decided to do before they launched the grant was really do community listening sessions to really understand what were the needs on the ground, because there are a lot of funding opportunities that were provided to community-based organizations throughout the pandemic. What they decided to do was to create small mini bid opportunities for community-based organizations to receive $50,000. And what they were able to do with that funding was to bring COVID health literacy into community-based organizations that were addressing social determinants of health as well as chronic disease prevention. So social determinants of health, it could have included organizations that were delivering housing, advocacy, it could be food pantries, it could have been those that were delivering financial literacy, as well as just programs that were really trying to address the holistic needs of populations throughout New York State. They were able to award over 175 small organizations across the state. And not only did they focus on bringing those resources, those financial resources to community-based organizations, they also focused on building the capacity up of those community-based organizations. Those organizations were provided training from we partnered, or that Bureau partnered with the fellowship and provided COVID-19 Public Health Corps citizen training. They also were able to receive community health needs assessment and health disparities training. Community-based organizations also received health literacy training just to equip them with skills related to bringing COVID health literacy, but also other health conditions, health literacy information. They also received quality and program evaluation support and training so that they could also, so the community-based organizations can continue to strengthen their capacity to evaluate their programs. And then last but not least, they also received risk management while responding to public health emergencies training as well, so that if there is another or future public health crisis, they felt more equipped to strengthen their organizations in our next or in a future public health emergency. So what we hope to do with our grant is continue to build on those lessons and at some point, hopefully release other funding opportunities to community-based organizations to also strengthen the public health infrastructure. So being a part of conversations and panels like this help us to really lean into community-based organizations, recognize different needs that you have so that we can make sure that we build those into our future procurements. That's all I wanted to share. Thank you. Thank you for having me.
Thank you so much, Keshana. That was wonderful and very crisp. Our next speaker is Salvador Altamirano Segura, who is the team leader of migrant services with Family of Woodstock. He has worked for the past 25 years serving and tending to the needs of migrant populations in Ulster County, which is to us down here in the city, upstate New York, but really is just like at the top of the Hudson Valley. He serves on advisory boards of the Ulster Immigrant Defense Network and the YWCA, and is chair of the Woodstock Human Rights Commission. Salvador has advocated with various systems of care for the improvement, access, and appropriateness of services for immigrants in a culturally adequate manner. He is also the agency trainer on cultural responsiveness, as well as the DEIA officer. We are thrilled to have him with us today. Salvador?
Yeah, hi, thank you, Danielle. And thank you everybody that spoke before me and for all that are present. This is where to start. You know, when we talk about serving the migrant population, it's like so many aspects. We're talking about human beings with all the needs of any human being anywhere in the world. And one of the things that we face is that migrant services tend to be focused on one or another thing. So our organization tries to provide, our motto is any problem under the sun. So meaning that we try to address any problem or any issue or any situation that a person or a family might present to us, which is a really tall task, especially we have a struggle financially to support the program. We need to do like fundraising or try to, we actually had 2 people that work for this program that are paid by another program doing something else, but they spare some time here and there. That's one of the ways that we're dealing with the not having enough capacity or enough staff for the program. So there are a lot of limitations that we see. You know, the legal aspect in our area is really difficult to navigate right now. We don't have enough. We have some private lawyers, but I can tell you that some few years ago, when immigration became so popular per se, many lawyers decided that they were going to be immigration lawyers from that point on. And we have had so many cases at that point of lawyers messing up cases because they did not have the experience. And they just took into immigration as if, oh, I'm just going to do that. Perhaps they were doing very well in their other practice or wherever they saw an opportunity to make money. And So besides being costly, it sometimes is not even appropriate, the service they're providing, and is very limited. So we have very few good immigration lawyers in the area, and we don't have nonprofit besides Catholic Charities, which also they have a lot of the caseload is huge. So that's one of the things that we are facing a lot of difficulties. Our organization has done, we assist with immigration cases, but when they're like simple cases that do not need a legal representation, like the TPS, or, that we did a lot of the DACA and employment authorizations or that type of thing. But right now with asylum, we're not going to be able to support people submitting asylum petitions or that type of thing. We're seeing some families now that enter through Texas per se, and they were given dates to appear in court in Texas. But now they have some relatives over here, so they move here. And so now you have to transfer the case to New York State. So they definitely need legal representation, and we're lacking legal representation. That's one aspect. Also, we do a lot of translations, which is another area that now is becoming a little more difficult. The language, especially translating documents for asylum seekers that have these statements that they made to somebody somewhere, and the language from somebody from Peru, somebody from Venezuela, somebody from Guatemala, somebody from Honduras, it really varies a lot. So we're doing them, but it takes a lot more time. When you're just used to one population, like from Guatemala, you get used to the language and what they mean by this, what they mean by that. But now we need to have a more diverse understanding of the same as Spanish language. There is also difficulties accessing grants and resources for us due to limitations. Some of them want you to serve a huge amount of population, which for us is not viable. One, because we don't have that capacity. Two, we're mostly a rural, even that is not considered rural area. Ulster County is kind of rural from my perspective. So there is not a huge population, and it's spread throughout. So it makes it really difficult to access those grants that I think they're more geared to big cities like Buffalo, New York City, even Albany might be, but not for smaller regions like ours. So that's one aspect too. I also am finding that I'm starting to see some burnout in the staff as well. Just yesterday, I was at a meeting where, some volunteers that provide work in a food pantry serving migrant population, they're starting to get resentful that some of them, because it just works in like a couple hours, and some of them are coming early and just watching them work and set everything up, but they're not helping. I'm like, well, that's just a sign of burnout to me, because you don't expect the people you're going to serve to help you, in that sense, like you're doing it because that's what you're doing. But anyhow, so another thing that we want to do and also feel a little bit shorthanded is in increasing programming that provides for new arrivals a real understanding of some of the laws that are very simple that can get them into trouble. We have many people coming from very small towns in, somewhere in Latin America and Central America, and, like public urination is not a big deal. You go around the corners, you go behind a tree and bam. But here you can get in trouble for that. which is not, it's that type of situation that are very, just like leaving a child unattended for a couple of minutes is another. Like the age of consent is another one. So there are many things that can affect really negatively their lives. So we want to increase that awareness through. Now, when it comes to health, I also see especially mental health. I don't think we have appropriate ways to deal with it in this system, as is the mental health system as it is set. Talk therapy or groups might not necessarily be the right approach for some of these populations. So we have started something like community conversations to see what would benefit, but also, how you invite people to those community conversations. Hey, we're going to talk about mental health. Well, and who has the time and who has the investment for it in terms of wanting to do something about it. So that's another area. I will be interested into seeing a partnership between the Western approach, the Western medicine and mental health services approach to traditional healing methods and approaches. I know that some of that service is provided by some of the religious services that happen, many churches and stuff like that provide kind of counseling at that level, and it's where people rely on. But to be honest with you, sometimes I do not trust the message that is sent. Some of them are really gender biased. Some have counseled women to stay in a domestic violence relationship because that's what they're supposed to happen. And he'll be better now, or whatever. So anyway, so I don't fully trust that. Not from everybody, but there's some like cases of that. So I also think that when I'm getting a feeling that every system of care, wherever this might be, gets a blind eye at some point or another. Like when we start thinking about problems and issues, yes, people think about the migrant population, but because of the same difficulties, it's easier to just sidestep and pay focus on something else. And just, I'm part of a homeless coalition, and nobody talks about the migrant population. And it's all this data about the homeless population that does not count the undocumented, because the undocumented don't get into those systems because they don't. So, and every time it's brought up, nobody's really like trying to come up with a solution or an approach. So we're starting something right now, but anyway, that's another area. I can keep talking forever about the things, but I don't know. I feel like when Key was talking, I'm like, millions of dollars is spread around. I missed the boat. Where are they?
Thank you so much, Salvador. The points that you raised, I think, are a great segue into the next part of our program, which is the discussion and Q&A, and that'll be moderated by Kathleen Crivero. Before joining CUNY SPH, Dr. Crivero spent about 25 years working for the United Nations, serving in senior positions in 5 different UN agencies and living in 4 different countries. An ongoing theme in her work is ending violence against women and children, which is one of the topics Salvador just mentioned in his remarks. Dr. Cavero, I turn it over to you.
Thank you very much, Danielle, and thanks very much to all the speakers. And Salvador, I think you really set up the discussion well, because there are some questions that were asked even before you started speaking that the points you made really make these questions even more important. And I think one of them, and I'll address this to Kiwi and Keshana, who both mentioned the availability of small grants. You could see from what Salvador said that the needs of migrant-serving organizations are, each one is unique. There's no migrant-serving organization, there's no cookie cutter approach. So I just wonder, Kiwi, if you could mention, like, how can your small grant program, or, do you have the flexibility in your small grant program to respond to needs that organizations like the one Salvador works for would have, around the legal aspects and the different kinds of issues he mentioned. And then for you, Keshana, the $50,000 grants you mentioned around some really important health-related things around COVID and health literacy. But what about if an organization, or if a number of organizations really signaled these mental health concerns and thinking out of the box about how mental health support could be offered? Would you have the flexibility? And I say this knowing that a lot of the flexibility depends on the flexibility of your donors, but it would just be interesting to get some responses to that. So first, Kiwi.
Yeah, so our regrants will fund, they're different regrants will fund different things, but many of them do directly support things like legal services. The 10 million plus government regrant that we're currently running is specifically being used to support legal services, case management services, and community outreach and education services. So that's definitely something that we try to support with the financial resources we provide organizations. And the majority, I'll just quickly note that the majority of our regrants are exclusive to our member organizations, although occasionally they are open to a wider spectrum of organizations. But I would encourage, for any organizations that are watching this, if you're interested in becoming a member of the NYC and be able to take advantage of these opportunities, I would feel free to reach out to me directly at membership@nyic.org, and I can talk more about it.
Okay, that'd be great. So I'm sure that Salvador and others have taken down that contact, so they get on the next boat pulling out in terms of small grants. Keshana.
Yes, so mental health services were actually one of the areas that was focused on in the grants that we released previously as well. But I wanted to even shine light on the points that you made, Salvador, too, as well, around rural, where the populations that you're serving are located, and recognizing that your populations are small, like that they might be small in comparison some of the larger cities within New York State. There was a rural carve out that was also part of the grant that we received from the CDC. So there was a completely different funding mechanism for us to get funding to smaller organizations as well, serving different populations. So again, this is like, we're kind of in that stage of lessons learned. I wrote down a ton of notes, I'll say, from your discussion as well, because we'll be thinking again about having a rural carve out, because there are different unique needs in large cities versus in rural communities as well. So to your initial question around mental health was included in one of the drop down categories for that specific funding opportunity that was released. But we'll continue to think about how do we pull in to make sure that everybody has a chance to receive funding to reach the populations in need.
Right, that's great, Keshana. And I think Salvador and others as in our work with migrant serving organizations, have also raised the point that Salvatore could only hint at because of time, which is thinking about mental health outside of our kind of Western concept of mental health, and which might be a cost-effective way of reaching a lot more people with support that they would really help them. So that would be great if we could get some kind of dialogue going. Erin, there was a question, a couple of questions for you. One is, if an MSO was interested in benefiting from a fellow, what would be, the next step? And understanding that these go to health, the health departments, but what would be a reasonable next step? And there's also a question about, are fellows limited to US citizens? Can migrants, asylum seekers, international students, are they also eligible to be fellows?
Sure. So if you're interested in being one, so right now we're kind of in this phase that's ending, but we local health departments have the option to post positions and recruit fellows up until December 31st of this year. So what I can do is I can share my email address with you all, and I can connect you with the coordinator that oversees. We've broken the state into 10 different regions, and they could then link you up with local health departments that are actively hiring. Or if you have an established relationship with your local health department, you can always reach out and ask them and express interest as well, to see if there's a way to collaborate. Right now, we're trying to secure additional money to keep the program going. What we'll do is, I think, probably have a new phase. So our current fellows are ending June and July of next year. And then the hope is to release additional money to have fellows placed in local health departments or at community-based sites, in the next iteration. So I'm trying to secure money that way. And what was the second question, Kathleen?
I think it was, who can participate?
Oh, right. Yes. Okay. So, so you don't necessarily need to be a US citizen or national right now. It's based on the hiring entity. So there have been a few local health departments that were able to sponsor individuals, especially if they were here for college, to kind of extend that. I know for the state health department, we cannot, you have to be a US citizen or national to hire to be a state health department. But yeah, so it depends on the hiring agency.
Okay, so that would on who is hiring within the local health department then.
Correct. Yeah. So I can say in the local health department, sometimes they're hiring directly by the county. Sometimes they're subcontracting out with like a staffing agency or a rural health network. And then we also have fellows who are hired through public consulting group as well. So yeah, but let me, Ansley, if I send you and the host and panelist the email address, can you put that in the chat to everyone?
Absolutely.
That way then, yeah, I can link anyone who's interested with the appropriate person.
Good. And I just want to mention that Kiwi also added that the AmeriCorps Vista program, with which NYIC is associated, is open to anyone that has a work authorization in the US. So it's not a matter of citizenship, it's a work authorization question. The other thing I just wanted to mention is that this burnout issue has come out a lot in our work with migrant serving organizations. It's a real problem. I think Salvatore, mentioned one example of it, but we see it across a number of organizations in different ways. The Center for Immigrant, Refugee and Global Health, with support from the Mother Cabrini Health Foundation, as I think Ansley put in the chat, is having a continuing education training around self-care for staff of migrant serving organizations, which is also open to staff of New York State Department of Health. And, all of us that work in these areas, I think we think of ourselves absolutely last. And this work does take its toll. So we just want you to know about that. Ansley, a question for you is that when the PRI, when you were talking about this, the survey and what the PRI could offer, it was a lot about capacity building and continuing education, where it seems like what a lot of organizations need is like concrete support, like here's a connection to legal, like competent. I think Salvador's question about not all legal advice is helpful. So, here's competent legal advice, or here's a small grant, or here's something very concrete, because I'm feeling it must be frustrating to some migrant serving organizations to hear about all the things that people want to teach them when they, actually need money.
Absolutely. So one of the things that I'll say is part of what we've been working on at the New York State Immigrant Provider Action Center, or IMPACT, is actually combining essentially a lot of different lists of service providers that are available to immigrants and actually putting them on a map. And I'm actually going to drop the link to that in the chat. But the goal of this is really to help both service providers, immigrant service providers, as well as immigrants themselves, and helping to coordinate care to find providers a little bit more quickly. We're currently working on getting, the language that providers speak, on getting that section of the map a little bit more fine-tuned. But essentially, we built this with the guidance of migrant serving organizations, including with voices such as Salvador's, to really inform the ways in which this map can be filtered so that individuals are able to really quickly find the type of service provider that they're looking for. In regards to your question about the legal, for example, finding a legal provider on the map, there is currently a legal category, and we are continually updating this map, adding additional providers, updating their information. And so hopefully you'll see this map continue to grow and improve over the next year and continue to be fine-tuned. We're also working to integrate this into an app. So we hope that we can provide that to providers in the next, I would say, year or so that they can remotely access this information on their telephones and quickly share this service coordination with community members. So that's kind of one area that we're looking at. And then in terms of funding, we're constantly looking for grant opportunities. We do share those on our newsletter for the Center for Immigrant, Refugee, and Global Health. So if you're not on our newsletter yet, I will drop a link to that and you can actually sign up. But I would say, keep an eye out there. We always are trying to post any opportunities that we come across. And then, we certainly hope in the future to be able to highlight some of the additional opportunities that Keshana and Kiwi highlighted. Anytime, those opportunities become available or there's a new grant cycle, we will share that with the community. We'd love to become a provider ourselves of additional funding, but that's in the works. So I'll leave it there, and then the link to our listserv is in the chat.
Okay, I think before I turn it back over to Danielle just to close, I just ask, I think Ansley just gave her takeaway message, but I just ask, going in the order that we went, if each of the speakers has one takeaway message they'd like to just to leave the participants with. So perhaps we'll start with you, Erin.
Sure. So yes, thank you again for for allowing me to kind of talk about the program. I know for me, it's really bolstering the public health, infrastructure and capacity at the local and state level. So, many of our fellows are at local or state health departments, but I do think kind of listening to everyone too, to try to be able to offer opportunities. And that's something I'll work on to make sure that, public health capacity and infrastructure is more than just governmental public health.
Great. Thanks, Erin. And just one thing that occurred to me when you were speaking before, you said there's 340 fellows, but there were 500, projection of 500. Is that the difference actually getting people onboarded, or is it a financial question?
Right. So we've had almost 500 be hired to date. So we've had individuals who finished their fellowship or left the fellowship early. So, you know, roughly, you know, some people have left to go work full time for the health department, that they kind of showed the capacity and they got integrated in. Same with the state health department. Others have left to go to school. So that difference is just fellows who, you know, finished their fellowship early.
Okay, thanks, Erin.
Yep.
Keshana, takeaway from you.
Yes, thank you again for having me as well. My key takeaway is just continuing to leverage the voices of the community into the work that we're doing. Really, my takeaway too is to be more intentional, making sure that we're very intentional of where our funding opportunities, when they are available, making sure that we can get them out to a broad audience so that everybody definitely has an opportunity to apply for those funding opportunities. So Ansley, as you mentioned, like I will take you up on that when we have different opportunities, that we make sure that we just get them out to a broader audience, as many people may not know where to turn to get different funding opportunities. So definitely being intentional in that space.
Great, thanks, Keshana. Kiwi.
Thank you. I guess trying to think of what would be a good final takeaway or reflection. I would just strongly encourage folks to continue to increase the size of their network, and whether you want to get involved with the NYC or other organizations that are doing similar collaborative networking type services, the stronger your network is, the more informed you'll be about different opportunities, and the more support you'll get as an organization. So I just encourage you to try to build those relationships. And again, if you want to possibly get connected to the NYC's network, feel free to reach out to me and my team at membership@nyc.org.
Great, thanks, Kiwi. Now, Salvador, we want to end with a voice from the front line. So your key takeaway to the participants and to other panelists.
Well, first of all, yes, thank you for the opportunity to be here and being invited. Secondly, yes, all I learned about these opportunities that I was not aware, which I've been looking into. I might be getting in contact with Kiwi. But more than anything, I really, you know, being a migrant myself and having at some point in my life received assistance from an organization, I cannot tell you how grateful I am to all the providers that are in this webinar or this workshop, whatever, for the work you do. The impact is incredible. Sometimes we might not feel like that particular organization didn't provide the service I wanted, but the fact that I was able to speak with someone in my language, it was so important and so meaningful. And I can see it with these eyes today, going back and like, it is just amazing. And please, I encourage you to continue, especially now there is a lot of rhetoric again against migrants. You know, it's happening everywhere. So please continue your work. You are amazing. Don't let anybody tell you differently. And really, from my heart, I love you all for that.
Thank you very much, Salvador. And I do think the themes of the webinar have been, how can migrant-serving organizations that are doing the incredible work that Salvador described, what is an appropriate way to support them? Because things have to be pragmatic. They have to evolve as the situation evolves. They have to be it's not enough to have money available. It really has to be accessible and possible for very busy people in overburdened organizations to actually, you know, first you have to know about it, then you have to be able to access it, and then you have to be supported to implement it. So all those things I think have come out from the various speakers. So I really want to thank you all and just turn it over for the last couple minutes to Danielle to close.
Sure. Thank you, Kathleen. Thank you to all of our presenters and panelists today. It was a very informative and wonderful conversation. I know I took notes, and that the issues that came up, like the siloing, when issues and system, when the problems are intersectional and the system should have an intersectional approach. The nuances that can get lost because of dialect when people are trying to document what happened to them, and how important those nuances can be for documenting asylum cases and receiving asylum. I know that's something that the law school is interested in. And this is one of many, many conversations we've had about the importance of trauma-informed care and mental health services and burnout support for staff who are providing these vital services, as well as mental health and trauma services for the migrant community. So many, and the need for financial support for organizations doing this work during pandemics or when needs increase. Also so important. And I know that the Center for Immigrant, Refugee and Global Health will be taking this into account as they develop new programs. It's something we'll be talking about at the New York City Pandemic Response Institute, and that we'll be having conversations about within the School of Public Health itself as we all pull together to try to resolve these issues. So thank you all so much. There's been links that have been put in the chat for where to find different information and where to get in touch with people. And a small plug for another joint CIRGH PRI webinar that you will soon be learning about, that it will be coming in November, where we try to we're trying an approach where we take two challenges and see if we can make a solution. So we're going to be talking about how the influx of migrants is actually an opportunity for the workforce in areas where there are severe workforce shortages like healthcare, and how we can pull together to actually create opportunities to bring migrants into the workforce in these shortage areas. So we hope you'll all join us in November for that. And I guess we'll end with a round of applause for all our presenters. So thank you.
You.